Hello, my name is Anthony DeRazio, and I'm a registered nurse currently working in the urgent care setting. However, prior to that, I was a registered nurse in the emergency department. I'm also a BSN student at Millersville University. Before I go further into what I want to talk about today, I just want to make it very clear that this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. You should always seek the advice of your physician or other qualified healthcare provider with any questions you have about any medical condition. You should never take anything in this video to use it to delay treatment or disregard receiving treatment because of something you saw. So today I want to talk about there's a lot of people who get really confused whether they should go to an urgent care or an emergency department whenever they are not feeling well. In fact, 30% of people surveys show actually choose the inappropriate care facility where they would best be treated otherwise. So some criteria that would warrant going to the emergency department: chest pain, shortness of breath, dizziness, lightheaded, passed out, feel like you're going to pass out. Those are all signs of the emergency department that is needed. Other things would be neck or spine injuries. They can be very concerning. In fact, some of those situations would even warrant calling 911 directly. Major blood loss, one-sided weakness, facial droop, slurred speech, major traumas and blood losses are all also reasons to go to the emergency department. Another reason would be an acute psychiatric emergency. So something like suicidal or homicidal ideations or ideas would be good ideas to go to the emergency department to receive care. However, not everything needs to go to the emergency department. An urgent care facility is well equipped to handle most injuries and illnesses. Ear pains, sore throats, typical colds that really aren't causing shortness of breath or feel like, you're going to pass out. Urinary symptoms like UTIs or concerns for sexually transmitted diseases are also good reasons to go to an urgent care. Even pink eyes, sprains, fractures, minor cuts and burns, maybe need a couple stitches, but nothing major. All great reasons to go to an urgent care. As far as like medication refills and chronic management, those are best handled by a primary care provider who knows you well medically and can make the best recommendations because they know your history. However, when you're not able to go to a primary care, an urgent care would be much better of a situation than going to the emergency department. So you're probably asking, why does this matter? If I can go here and go there, I'm still going to get treated for it. And that is correct. The ER will always see you, and the urgent care will always see you as well. However, if you go to an urgent care for something that needs to be seen in the emergency department, you are delaying time in your care. While the urgent care will do an initial evaluation and then refer you to the emergency department if it's warranted, you could have gone to the emergency department directly. Not only would that have saved you time, but now you're paying for 2 evaluations when you could have just paid for the one at the emergency department. On the flip side to that, those who go to the emergency department with something that could have been treated at an urgent care often run much higher medical costs. Urgent cares are often much cheaper than emergency department visits. Also, historically, studies show that urgent cares have significantly less wait times compared to the emergency department. So if you can go to an urgent care, you'll probably spend some time there. So what if you're not sure where to go? There's lots of resources out there. I would strongly recommend most insurance companies offer, you can call them, you can speak to a registered nurse who can provide like a triage service to recommend which one would be the most appropriate. Most major health systems also have a nurse triage line where you can call and speak to a registered nurse and get advice on where you need to go to be treated. So those are just some of the ways to determine whether does this need to go to the ER or whether this needs to go to the urgent care. It can be really confusing, and ultimately, if you're not sure, going to the first closest facility, maybe that is the ER, can never go wrong. But when in doubt, if you can, it's always good to use the most appropriate setting. I hope that explains some of the questions and, myths and confusion out there about all the different facilities you can go to on where you can get the best care. Thank you very much.